Okay, now we're going to be doing positioning for the barium enema, and there's not that many barium enemas performed these days since colonoscopy has come on the scene, and that seems to be the preferred method. But when you are imaging for the barium enema, you have to keep in mind you need to be as quick as possible due to the patient's holding an enema while you're taking all of these projections. So after the radiologist has come in and the patient has received the enema and he's taken his spot images, typically there's several images following that he likes to have. So I'm going to do the AP, and I'm using the large image receptor. Now we're going to be using the large image receptor on all of these, the 14 by 17 or 35 by 43 centimeter. We're going to be using it on all of them except for the rectum image, which will be the 10 by 12 or 24 by 30. So make sure that you are centered to the bucky. You want to be sure all of these factors are set up and ready correctly so that we can get through the exam quickly while the patient is holding in their enema. So I have my right marker on here indicating the right side of the body. So you're going to palpate the crest, have it mid-sagittal, and then you take your image on expiration. So you'll instruct your patient, take in a breath, blow it out, and hold it, and then take your image. Alright, next I'm going to go into the AP obliques. I'm going to do an RPO and LPO. So have your patient turn 45 degrees. Again, check your angle to make sure it is correct. Okay, palpate for the crest. It's going to be your transverse line, and then find the midline of the patient, and your longitudinal line is going to be 2 inches above that. So here's his midline. We're going to be 2 inches on the upside here. Okay, I'm going to bring this leg back just a little bit. Okay, so this is our RPO. And then we're going to do the LPO. Okay, I'm going to bring them back just a little. Palpate the crest, find his midline, and go 2 inches to the upside. And because this is the LPO, we want to use our left marker. So either put your left marker to the left edge of the cassette, or for the DR units, you can just lay it to the left side of the patient's body. Okay, that's our LPO. Okay, now turn over prone. The next will be the PA projection. Palpate the crest, and then get the midline of the body. Okay, mark the left side of the body. That is our PA projection. Then I'm going to do the PA axial, which your tube angle is going to be caudal 30 to 40 degrees. Okay, be sure you line up your bucky tray since you are moving your tube. Use your left marker since this is the left side of the body. Okay, I'm going to palpate his crest, and then the central ray is going to cut right across at the level of the ASIS. So we have that central ray. You can see it coming across. If you were to look at the actual edge of the line coming out, it's coming across at this level, ASIS. And then, of course, always check your bucket tray, make sure it is lined up. So that's our PA axial. If your patient's not able to turn prone, you can always do the axial as an AP. If it is an AP axial, you're going to have a cephalic angle of 30 to 40 degrees, and your central ray is going to enter 2 inches below the ASIS. Alright, now I'm going to do the lateral rectal picture, and patient will be on their left side. We're going to change to the smaller image receptor, which is the 24 by 30 centimeter. scoot away from me a little bit. Okay, so you're going to palpate for the ASIS. Your transverse line is going to cut right across that level, and then we're going to be mid-coronal. Okay, so that is our rectal projection, the left lateral. Now, this routine is for the single contrast barium enema. If your radiologist prefers to do the double contrast barium enema or the AC barium enema, we're going to do some additional images, and that's the Decubitis images. So since David's already on his side, I'm going to go ahead and set up for the Decubitis of the left lateral. So first of all, you want the patient to scoot away from you just a little bit. I'm going to be using a cassette holder to hold my cassette. This is the image receptor holder right here, and I'm going to go ahead and put my IR in it, and then find the level of the iliac crest and put the film right centered at the level of the iliac crest. I'm going to build him up on these positioning sponges, so lift up your side, okay, and then lift up your hips, okay. So this is going to build him off the table so that we can see that bottom edge as well. And then go ahead and pull out the x-ray tube so that you have the horizontal beam. Alright, so you want to check, you want this line going at the mid-sagittal, and then we want a transverse line at the crest, and then open up your field size so that it is getting the entire length of the 14 by 17. Now I'm going to open it up slightly beyond the edge of his skin so that I can place my marker. We're going to mark the right side that's up by putting the right marker right there. Okay. So this is our left lateral decubitus image for the colon. So next we're going to do the right lateral decubitus of the colon. So the patient lays on the opposite side. You want the sponges underneath their side.
Just double check on there. I don't think you can see us with that too. I just thought of that.
Nope.